Welcome everyone. We have participants joining, so we are waiting a couple of minutes so that everyone is in place. The participants are coming in. Welcome everyone. We are almost ready to start, so hang in there. We're waiting another couple of minutes for the other participants to join as well. Okay, the number is a little bit stable now. People should be joining more soon, so I think we are ready to get started. Just stop this screen. There. So let's start officially. Hello, participants. Welcome, everyone. Welcome, speakers. My name is Sabrina, and it's my pleasure to welcome you to the second episode of the Unscn webinar series on nutrition in a digital world. This episode will address the theme of the opportunities and risks of digital technologies in nutrition behavior change and capacity building. And we have a very exciting lineup of speakers today. And this theme in particular is very close to my heart, as I have worked with behavior change and nutrition education for many years. And I am currently working with digital technology in nutrition. So I'm very excited to see what the speakers have prepared for us today. But before we start, I would like to give you all some practical information to ensure that the webinar goes smoothly. So please be informed that the webinar will be recorded, and it's already being recorded from now. And the recording will be made available on the Unscn official channels of communication, including the website. So you can watch it again later and share it widely. Our language for today will be English only, in writing and in the presentations. Please follow the webinar with your microphones muted. And if you would like to make a comment or ask a question to the presenters, we kindly ask you to submit them in writing by using the question and answer feature. You can find it at the bottom of your screen. And please start your question or comment by stating to who it is addressed. So please write the name of the speaker you would like to ask a question to. If you need any technical support regarding the Zoom functions, you can submit a comment or question in the chat box. I would also like to kindly ask you to take a moment after the webinar to participate in the Unscn Knowledge Management Survey. The link for the survey is being pasted in the chat box as I speak. The Unscn has, over the years, prepared several publications, including articles, policy briefs, and several reports. And we would like to have your feedback on those publications, those resources, and we prepared a short survey for that. So please access the link and give us your feedback. That is going to be very helpful for us while the Unscn is moving and transition into UN Nutrition in 2021, so we can plan the way ahead. So those were the general comments, general guidelines, practical information for today. Each of the speakers will be presenting for 10 minutes, and we will be collecting your questions throughout, and we will have a moment to address those questions orally at the end, where the speakers will be able to comment. So without further ado, we are ready to start the session by welcoming Dr. Inka Barnett, who is a senior research fellow at the Institute of Development Studies in the UK. She is a behavioral epidemiologist and nutritionist specialized in designing evaluations for programs that use innovative digital technologies to promote behavior change in health, nutrition, and agriculture. So, Dr. Barnett, the floor is yours.
Thank you very much, Sabrina. I would like to talk over the next 10 minutes through a little bit about our findings and lessons learned from our evaluation of the malnutrition program. The evaluation was done by a consortium of researchers from the Institute of Development Studies, IDS, IFPRI, and GAMOS. Malnutrition is a mobile phone-based advisory service that uses SMS or recorded voice messages to promote behavior change around key nutrition and agriculture behaviors. Nutrition is a large-scale initiative that was funded by the UK's Department for International Development, now FCDO, implemented by GSMO and the local mobile phone network operators between 2013 and 2019. It's not a pilot program, it's a large-scale program that was rolled out across 12 countries in Sub-Saharan Africa and Asia at a national scale level. To explain a little bit how malnutrition works, the content of malnutrition was developed by GAIN, then adapted to the specific countries and delivered via existing mHealth or mAgri platforms. The focus of our evaluation was malnutrition delivered via an mHealth platform in Tanzania. The end product was called Vazazi Nependeni, and via an mAgri platform in Ghana. The end product was called Vodafone Pharma Club. The overall aim of nutrition is to scale up the delivery of nutrition and agriculture information and to promote behavior change that will ultimately lead to better nutritional well-being. Briefly, our evaluation design, we used a mixed method evaluation design consisting of several qualitative rounds, an experimental quantitative design, and a business model analysis. Further details on the methodology can be found, of course, in the paper. To our lessons learned and findings for mobile phone-based interventions to promote behavior, uptake and sustained engagement is of course key to promote a change in behaviors, but also to be commercially viable. Unfortunately, the uptake and reach of malnutrition was relatively low. In Ghana, only 34% of our treatment group said that they have ever received a recorded voice message. In Tanzania, it was slightly higher, 66% said they received an SMS message. However, this declined quite a lot throughout the intervention periods. Especially poorer households and women were often excluded, purely because they didn't have reliable access to a mobile phone. Other barriers to reach an uptake were the lack of an available supportive infrastructure. Here, network coverage was a problem, especially in Ghana with Vodafone. Also, the common practice of using different SIM cards was a challenge because the SIM card that was used to subscribe to malnutrition was often not in use, and therefore a lot of the service was simply missed. The capacity of the user here, illiteracy for the SMS, but also Lack of familiarity with recorded voice messages was a challenge to uptake. There were some issues with implementation, for example, fluctuation in the service that could quickly lead to disengagement. Some smaller issues with the design, for example, a complicated registration procedure that meant that a lot of people stopped halfway through. So how can reach and uptake of mobile phone-based intervention to promote behavior change be optimized? So first of all, before you start, make sure that the supportive infrastructure is actually in place for a large proportion of your target population. If this is not the case, consider alternative approaches, for example, radio, or merged or mixed approaches. Consider whether there might be gender-based exclusion for women having access to a mobile phone. This could be an issue even if there is a mobile phone available in a household. A woman might not have access. Design your service to match the capacity of the target group. Don't work on assumption. Don't assume everybody knows what a recorded voice message is, for example, and use specific design features to increase uptake and sustained engagement. With regards to the impact of malnutrition on knowledge increase and change in behaviors, we found only very small impacts. In Ghana, there was no impact on nutrition and agriculture behaviors or knowledge. In Tanzania, we found some small increases in knowledge in infant and young child feeding practices and dietary diversity, but no change in nutritional status. However, among the users that actively engaged and used malnutrition, in the qualitative work, we found a variety of individual behavior change. Most households reported to have changed at least some of their behavior and practices. The reason for the limited impact is, of course, the poor reach and the very limited sustained engagement. Then the fact that lack of information might actually not be the limiting factor for poor practices. And of course, barriers to acting on that advice, and here in particular, lack of cash. So what can be done to create more effective mobile phone-based intervention to change behavior? Based on our evaluation findings, we recommend introduce interactive components wherever possible. Don't rely on just pushing out information, but link it to some kind of interactive channels, for example, call centers. Offer human support wherever possible. This is particularly important for some practices where skills need to be learned, such as breastfeeding, which can be really difficult, or also to promote uptake of high-risk agriculture practices. Human support is very effective and necessary. And combine mobile phone-based services with other services, such as financial services or social protection program, that are able to address some of the underlying barriers to poor agriculture and nutrition practices. With regards to the development of the content that was delivered via malnutrition, we found that it's really important that the content is really carefully tailored towards the specific needs and characteristics of the user group. In malnutrition, the acceptance of the content was really high. People were happy. They found the ones that engaged with it found it useful. They find it easy to use. Their trust in the credibility of the information they received. The recommendation that came out of the evaluation were consider providing very practical, hands-on advice that is actionable and achievable, especially as this kind of more practical advice is often missing from the traditional services. For example, health workers often don't have time to provide very practical, tailored advice. So the mobile phone-based intervention might be able to address some gaps there. Ensure that the content is very carefully tailored to the needs and individual characteristics. We found that even one poorly tailored message can lead to disengagement with the service, especially if there is no human component. And introduce or strengthen existing two-way communication channels, such as call centers or active search functions, if possible. To sum up, we found, based on our 5-year-long evaluation, that mobile phone-based advisory services alone tend not to be enough to make a big change in nutritional outcomes, because the reasons for nutrition behaviors are more complex, and so the mobile phone by itself is often not very effective. Human support is vital to kind of trigger behavior change. There are still outstanding implementation and programmatic issues that need to be addressed, and that can in particular negatively affect reach and uptake and sustained use. There is a risk that especially vulnerable people and women are left behind. And mobile phone-based services are most likely to be effective if they are embedded in existing trusted structures, such as agricultural extension services, health services that can also provide this human support that is needed for a lot of the behavior change. If mobile phone-based services are linked with other programs, such as social protection programs that can address some of the underlying barriers for behaviors, and here in particular poverty, and also consider other channels or merged approaches, such as introducing the radio as an additional challenge to include people who don't have access to a mobile phone. You can find more information on our evaluation, of course, in the Unscn paper, but also on our website where all the evaluation reports are published. Thank you very much.
Thank you so much, Inka, for your excellent presentation. I think we are up to a great start. And thank you also for mentioning the Unscn publication. If the participants aren't familiar with it, in June this year, the Unscn published a report with a series of articles. It's called Nutrition in a Digital World. It's the issue 45 of the Unscn Nutrition. It's available on the website, and all of our panelists today have published exciting papers there where you can go and read more to follow up on their presentations today. So thank you, Inka, for that start. I think it's very important that there has been a lot of interest in nutrition, and it's very good to see concrete examples that have been evaluated and that we know then what lessons can be learned from that process. And a particular relevance is the fact that you mentioned the infrastructure difficulties as well, which points, as usual with nutrition, to the fact that we need to work cross-sectorally to be able to achieve our goals. And we continue then on the topic of designing behavior change interventions and supporting nutrition professionals to do that. We continued with Fernanda Ferreira dos Santos, our next speaker, which will be focusing not on nutrition, but on social media as a channel to do that. And Fernanda is a nutritionist in the Metabolic Syndrome Academic League at the University of São Paulo Medical School. She holds a master's degree in nutrition and public health from the School of Public Health at the University of São Paulo in Brazil, where she graduated as a nutritionist. So Fernanda, if you can start sharing your slides and your presentation, the floor is yours. Thank you.
So, hi, I'd like to thank the opportunity to be here with you today with such great research, and I'd like to be part of this amazing project. So, I'd like to talk with you about some important points. Let me just see if it's showing. Yes. I was invited to discuss some important points that by the time we were developing my project and when making my master project, some health professionals used to look at us with some straining eyes, like if they didn't believe in the capacity of the digital world and social media to promote and to build good intervention to promote change in behaviors and to help our society to have a better view of their food intake and choices and so on. So we were these happy
Fernanda, excuse me. Could you try to speak a bit closer to the microphone so that we capture audio on the recording? Thank you.
Yes. Thank you. Do you want me to repeat? Well,
no, I think it's fine. It's just okay. from now on. Thank you.
So by that time, we were like this guy who was looking at his phone, really anxious to work with this, and some other health professionals look at us with some expectations that maybe this would work or not. And unfortunately, by that time, this this way to view social medias were not so present in our academic society, at least not in Brazil, not in nutritionist reality or other health professionals, not as deep as we wished. And we saw a huge potential to use this to communicate with the general population and to build bridges among the academic society and the general population. So when we saw the call for this paper on nutrition in digital world, we saw a great opportunity to share with you and with the world our finds. So, and more than ever, those who are looking at us with some suspicion eyes that it wouldn't work, they are sure that it works and that it's necessary to learn how to deal with social medias nowadays, especially because we are facing an academic moment that made us change our lives or the way we work with each other, right? But we need to keep in mind that it's not as simple as some people think when we want to work with social media to build interventions and to communicate with people. We need to know with who we are talking to, what they want to see, how they want to use these social medias, why they want to use it, who are they, and where they are. We need to try to tailor our interventions and our actions when using it. And on our project called Nutrient Interactiva, we tried to do it. We asked participants what would they like to find in an nutritional intervention developing on social medias? What social media would they prefer to use? Which presentation format of the contents, what contents, etc. And most of all, we wanted to know why they would want to participate of it. And from the 281 answers, we found 4 groups of answers that most led our conduct during the project. In the first group of answers, we saw participants who wanted to contribute to scientific research. One of these participants said that he wanted to participate because of the importance of contributing to research that connects scientific production and the lay population. In the second group, we found people that had the curiosity to find out what it was about. Most of them actually was health professionals, because by that time it was not so usual to use these tools in Brazil. Actually, our ethical conducts are quite limited in this point. We can't do many things, and when we use it, we need to be careful to not do what is not right. So one of them said, media and nutritional curiosity. I found the project innovative. Congratulations. It was new by the time. Actually, it was last year, but for them it was new. In the third group, we found people who wanted to change behaviors and actions related to food and health. One of the respondents said that wanted to participate because of the need to improve eating choices and because of financial impossibility to hire a professional, what is a huge problem in Brazil. And in the fourth group, we saw those who wanted to learn how to improve food choices. One of the participants wanted to learn how to improve their choices in-house and outside the house, because when she was in-house, she used to not have meat. So each person had a different motivation to be part of this intervention, but a lot of people wanted to participate. So by the answers of this questionnaire, we were able to discover participants' motivation to be part of a nutritional intervention developing in social medias. And with this knowledge, we need to point something that call our attention. Some of those who pointed that wanted to change behaviors and actions related to food action wanted to lose weight. People wanted to lose weight. And even though this wasn't our objective, our main objective, and they knew it, most of them as well did not have access to health professionals. And these 2 points calls our attention to the fact that they were putting their hopes into this project. And when they were doing this, you are able to notice that our project had more importance than we were thinking actually, because I'm sorry. This project was important not only because of we were creating a path for new researchers, but as well we were working with people who were putting their trust and their hope in us. And on the other hand, when you're working with this, we open a door to something that is really important to keep in mind. On social medias, we have the scientific information and unscientific information. And the unscientific information is problematic because we have the experience from those who are not health professionals or health professionals, and that is really important because with experience, we have the change of experience with each other, and it's something really important and productive. But we still have the misinformation, and misinformation is quite complicated because we can lead people to do things that are not right. And on social medias, we see these kind of things really frequent with a great frequency. For example, we have many posts on Instagram and other social medias of people who want to sell miracle solutions, strategies to have the ideal body, and even cure for coronavirus, things that can be dangerous for people's health. So it's quite problematic to have this space without good professionals who wants to pay careful attention to the needs of the people who are using these social medias. On the other side, we need to keep in mind when creating intervention on social medias that people get bored easily. And even though you take care about the content, the quality of the information you are sending to your public, people get bored. So if you create a text really huge, people will get bored and pass to the next post. So you need to get the attention of your public in seconds, otherwise they will give up on you and go to the next post. And so we not only need to pay careful attention to the quality of our content, but as well to the way we summarize our information, so we pass the message. So when we want to develop a nutrition information or, I don't know, other areas of health, we need to keep in mind a few points. We need to set our objective to get to know our audience, their demands, their wishes, their reality, to really tailor your actions while using the social media. Plan your actions, prepare good content, and be present. Keep in mind that people nowadays don't have that patience to read or to get in touch with great and huge and long contents. And this is it. I'd like to thank the opportunity to be here with you today, guys.
Thank you very much, Fernanda, for your presentation on social media. I think it's very interesting that you mentioned some aspects that are crucial when developing social media health communication interventions that are, in fact, similar to also aspects that we need to take into account when developing offline or non-digital health communication, nutrition communication interventions, such as, for example, having in mind your target group and tailoring your messages to that. And as Inka previously mentioned, that one tailored message can lead to bigger problems for the whole of the intervention. So that's excellent that you also mentioned that. And on that line, we are moving ahead with our next presenter, which will talk about how choosing the right group was also fundamental for the success of capacity building intervention focused on frontline women workers. So I would like to welcome our next speaker, Dr. Archana Sarkar, who is an advisor in research monitoring and evaluation for the India country package in the Food and Nutrition Security Enhanced Resilience project in GIZ. She has social behavior change experience on adoption of good nutrition practices, innovation in nutrition, data and nutrition platforms, among other things. So Archana, please, looking forward to your presentation.
Thanks. Thank you, Sabrina. Uh, Good evening from India and welcome all to this presentation and to this webinar. Today I'm going to present about Anganwadi Shiksha, or it's a e-learning platform, training platform to empower frontline nutrition workers in Madhya Pradesh. I will today present features about the platform, what is this platform about, and an effectiveness study that we did to understand how good it is in improving the capacity of the health workers, and also its content, its features, and its adaptability. So that we are going to present. And this was done as part of GIZ developed this with the Department of Women and Child Development in Madhya Pradesh as part of GIZ's Food and Nutrition Security and Enhanced Resilience Project. Funds or this project is a global program of GIZ, and it's being implemented in 10 countries around the world, 8 in Africa and 2 in Asia. And it's the basic objective is to improve the nutrition situation of women and young children. So here we go. As you know, Madhya Pradesh is one of the high burden states of India in terms of malnutrition, and it has a very high levels of stunting and wasting of children under 5 years of age. And Madhya Pradesh stands in 5th position in terms of the burden of undernutrition, wasting, and stunting and anemia prevalence among women and children. So this project is focused towards the state of Madhya Pradesh. And here we are doing this platform along with some other interventions on nutrition education. So Anganwadi workers are the social health workers in India, and they are kind of employed by the Department of Women and Child Development. And this is the Ministry of Women and Child Development, which is responsible for nutrition of women and young children in India. So they are employed from the village where they reside, and each village has one Anganwadi worker. But often that they have various education levels, generally very low educational levels. Sometimes they are 10th passed or even low primary education also. But they are like, from that region. So they understand the culture, the context, and also the beliefs and everything, the health pattern, the diet pattern, everything. But then there are knowledge gaps on adequate nutrition. Further, they also lack access to good training also, because they're often in remote locations and it's difficult to organize training, to get them into the training centers. And they're often trained in classroom trainings with very high content of knowledge. Sometimes they get very overwhelmed with so much of knowledge on nutrition. There are like 160 pages of content and 7 modules, and it's too much of sometimes for them. So that's why we thought of developing the e-learning tool along with the Department of Women and Child Development, so that they can have access to structured and standardized training sessions. And to fill this gap, GIZ funds developed this e-learning platform where the whole content was kind of evaluated and compressed into a interactive learning tool, which had various different interactive features to motivate the learners. So as you can see that we had like, it's an open source, so anybody can kind of use it. It's now institutionalized with the Department of Women and Child Development. And the whole learning is now compressed into 40 hours of e-learning with very real life scenarios. The pictures were drawn, the animations were made as much possible to the real life as possible. And here we used a technique of gamification. As you may know, that gamification is nowadays a very attractive way of engaging learners, and to have nice content. It has interactive videos, quizzes, so that it can give feedback. It would have animation sequences, which would be very real life, like things. And then also there will be an emoji also when they kind of give right answers or when they clear one module. And also after each module, there were also assessment questions, which was in a very fun way, so that people don't get motivated. Anganwadi workers, even who have very low levels of education, they can also do it easily. And the language was, of course, Hindi, and it was taken care that the dialect also taken care of, so that Anganwadi workers from remote places are able to kind of understand this. And also certificates were provided on successful completion. We also had a dashboard which was integrated with the department's MIS, so that the MIS officials can track the learning graph, so that they would know how many Anganwadi workers have been enrolled, how many could complete the course, how many were stranded in between, how many were in progress, and how many had kind of completed it. And also there was like each Anganwadi worker was tracked in this dashboard. So it was very useful, so that for the government to understand that how many were actually going through this e-learning platform course. And now it is currently with the DWCD Madhya Pradesh, and it's being used there to promote e-learning platform and to also track how the learners are performing there. Now, we also did a study on this platform so as to understand that how effective it is in improving the capacity building of frontline workers. Also, since we had started rolling out the platform in Madhya Pradesh, which has almost 100,000 Anganwadi workers, we also tried to understand that whether there is any need for any modification of content design or user friendliness or any features of the platform, so that in the next phase we could tweak these features and make it more useful for them. And also in a country like India, which is huge, and where there are more than 100,000 workers, simply in Madhya Pradesh, to understand the implementation challenges was very important, because that could sometimes be a barrier in implementation of a successful e-learning platform, even if the platform was good and tailored made for the Anganwadi workers, and it has all the features. So we tried to understand these three mainly questions. And we used a mixed method analysis, and in a quasi intervention design, we had survey questions where we asked from intervention mean those who have completed the this course, and in the control those who had no exposure to this e-learning platform whatsoever so far when this study was done. And then we tried to capture that information on knowledge, on their difficulty of services, how do they deliver on their roles and responsibilities, everything. And we also, for those who have done this tool, we also asked their usability, efficacy, and what are the challenges they had. Then we also had in-depth interviews with their supervisors, because they were involved in the training and also orientation of the platform among the Anganwadi workers. And we also did focus group discussions with the Anganwadi workers so as to understand more of how they are using it, what are their problems, especially in the remote areas where there is not that much of facilities are there, not much support is there. One of the key findings that we found that knowledge enhancement was it came out quite significantly in this study, both in the quantitative and qualitative it was given like they had more knowledge and more significantly higher knowledge than the control workers. And this was like more because of the very interactive and interesting features in which the knowledge was given in the platform. And then we also found the content, language, and visuals. We asked specific questions on them, and we found it very comprehensive and systematic. And also it was very much local scenario based, so that they could very easily understand the content, very easily understand the roles and responsibilities of Anganwadi workers, what is the correct knowledge, what is not the correct knowledge, even for the which vitamins are there in which fruits, which should be promoted. So they were done in a very interactive, smiling, and with some cartoons also, so that it's very interesting and engaging with them. And also it was found that the questions that we gave at the end of each module was also kind of a reinforcement, and it improved their performance and learning. And as you can see, almost 92% felt that the content was easily understood and comprehensible, and 64% felt that it was in greater detail than in classroom training. And yeah, user friendliness is a very important, because it's 40 hours of learning, and it could be used in mobile, tablet, or computer, but mostly it will be used in mobiles only or in tablets, so that if the maneuverability was important. However, for those who were, there were some Anganwadi workers who were illiterate also, and who have very low levels like education, they had little difficulty in maneuvering the phones, but still the picture and the videos made it quite interesting for them. And also that dashboard was there, but then the feedback mechanism needs to be a little more improved, so that they can have a live dashboard. They would know if some Anganwadi worker is stuck somewhere, they can easily seek help. That needs to be a little bit more improved in the platform. And also a lot of them felt that it didn't take much time to understand how the e-learning works, and a lot of them could complete the course within a month or sometimes in 2 months. And it could be done in parts also, like the 40 hours doesn't mean that they have to do it in one go. And but there were some issues with implementation as expected, and also because it was rolled out by the government. So how the communication flows was very important. Sometimes a little ambiguous information went into the field, which caused little problem in the implementation. Sometimes internet connectivity was an issue, as although offline modules were available, but still it was not very well kind of told to them. So that was sometimes they gave up, because they thought that if internet is not there, we will not get it, we will not be able to do it. And also the training and handholding was also a challenge, because we had district level orientation where the supervisors were trained and they were supposed to train the Anganwadi workers. So that also, maybe we can also think of integrating a little bit more of training. So that also something we found that in the first phase, that also played a little bit of obstacles for us, but we are still working on it, and we will be in the funds 2.0. We have this 4 years, and next four years to kind of to roll it out in a very sustainable manner. And also the smartphone is also a problem, and after the rollout, we can have an operational feasibility of the full rollout study also. The conclusion is that yes, it can fill a capacity building gap and enhance the knowledge and counseling of the frontline workers. They can easily be trained on it. The visual contents and the quizzes and the animations play a good role in enhancing the interest and motivation of the workers. And also there were some recommendations, like to include counseling of men, include nutrition rehabilitation centers, and very recently include a section on COVID, how COVID has influences food and nutrition security. That has also been kind of recommended, and it provides a good platform, an opportunity to train frontline workers with minimum resources and a maximum reach, that it can be reached to a huge number of workers. And yes, now we are now also working on the upscaling and replication. The advantage is that it can be adjusted to other states in India, and we are already in talk with other states, especially the Hindi-speaking states, which can be easily replicated. It can be used in any other learning management system, and also it's very complementary to the other approaches in India, like incremental learning approach. It can work as in a complementary manner to this. And you can see the reach, that it can reach up to like 1.4 million Anganwadi workers if it's upscaled in India. So that's a good thing. Yeah, thanks for your attention, and thank you. That's it.
Thank you, Archana, for your presentation. It's very interesting to see that some of the themes, they go cross-platform. So we have now had a presentation on nutrition, we have had a presentation on social media, and now on e-learning platforms for different publics. And still, we can see that the targeting is important, but also the design of the messages and making sure that they're culturally appropriate, to be acceptable, and that they're interesting, and that they really catch the attention of the target audience. So I think those are very important lessons that we are taking from today. And another issue is that the information that we are promoting should definitely be evidence-based to promote healthier nutrition habits and healthy behavior change. Nevertheless, as Fernanda has already alluded to, that's not always the case, that the information that we come across in different digital platforms are evidence-based, and we are living in an age where misinformation is a very big problem. So those are some of the topics that our next presenter is going to talk about regarding social media, and also a little bit beyond that. And that is Alessandro Marcon, who is a research associate at the University of Alberta's Health Law Institute. He has his work has focused primarily on the dissemination of health information and exploring how the media, both popular press and social media, represents key health and science issues, from genetics to breastfeeding and vaccination. So Alessandro, the floor is yours.
Hi, everybody. It's a real pleasure to be joining you today. I'm joining you from Edmonton, Alberta, Canada. We're currently covered in snow here. And what I'm going to do is just share the paper that I submitted to the Unscn Nutrition 45, which is titled Microbiome Research, Nutrition, and Social Media, a Messaging Muddle. And I'll just provide an overview of this paper and expand on some of the topics. So we know that social media growth is happening all over the world. If you can see on the far right there, we have more than 11% growth over 1 year time from people who are active on social media. And one of the big problems that we have is that there's a lot of unclarity around how much people actually understand these platforms that they're using. This was a study that came out of the United States from the Pew Research Center. And what it shows is that 74% of the people using Facebook did not understand that their data was being classified and that certain information was being shown to them because of the kinds of activities that they do on the platform. This could include the content that they're exposed to, or their accounts, or some of the advertising. And also telling is that 51% of the people, after learning this, found that they were not comfortable with Facebook compiling this information. So there's a real disconnect there between what platforms people are using and how much they actually understand them. Just to share a little anecdote of how these environments can change, I recently read this book called Cultural Warlords, which was by an American author, Talia Lavin, and she was exploring kind of hate speech and white supremacy on the internet, on kind of dark pockets of the internet. And as I was reading this book, I was searching for some of the web pages that these kind of nefarious web pages that she was talking about. And when I returned to my Facebook, what I found is that I had received advertisements that I had never seen before, advertisements for different political leaders and some very, if I can say, kind of sketchy websites that I'd never seen before. And this is only after spending 5 minutes Googling for some of the websites, how much my environment changed. We know that anti-vax sentiment is growing a lot on social media, and it's really impacting people. This was a study that came out of the University of Pennsylvania, which found that people who relied on social media were more likely to be misinformed about vaccines than those who use traditional media. And the same thing is being observed right now with the COVID pandemic. This was a study that was done from McGill University in Canada, along with University of Toronto. And as they summarized here, we find the exposure to social media is associated with misperceptions regarding basic facts about COVID-19, while the inverse is true for news media. These misperceptions are in turn associated with lower compliance with social distancing measures. So we're starting to see that real connection between being exposed to information that's not accurate and then making not evidence-based decisions, or not heeding the advice of health experts when it's needed. This is, of course, we have to be careful when we talk about social media and assuming that it's completely problematic. Social media, of course, as other presenters have talked about here, provides an enormous opportunity for people. This was the story of an individual in the United States who had never been vaccinated, and he was concerned about this, and he just turned to a social media site like Reddit to ask lots of questions and learn about vaccination. And we noticed this in some of our own research. This was a study that we performed on non-invasive prenatal testing on the social media platform Reddit. And what we saw is just a lot of people very eager to reach out and to find information, and a lot of camaraderie inside of those communities. People that are very patient and eager to share their time with other people and to share links. And in this particular study, we were happy to see that people were sharing accurate government information in some cases. Of course, this study was not to determine the accuracy of the information. It was just to try to summarize how people felt about this piece of technology. Similarly, when we studied breastfeeding on Instagram, again, we saw a lot of camaraderie, a lot of people trying to support other people in their endeavors. So there's definitely a space here that health practitioners and health officials can engage with to try to inject these sites with more evidence-based, more accurate information. Of course, when we think about social media, we need to think about the idea of the attention economy. This is platforms that are designed to keep people created and keep people engaged, and they really need to generate clicks and shares. So this tells a lot about what kind of content is created. It's content that is very catchy, it's very slick, it's very catered and designed to be attractive and to generate shares. It touches a lot on people's emotions and sensitivities. And of course, the main reason that this is created for these businesses is because it creates advertising profiles of people, which is data they can accumulate and sell and share. And there's this interesting development that's going on here where the content now is becoming the product, both for users and for corporations, where a good example I can give of this is the case of this was a famous commercial that took place in North America, a very cringeworthy commercial. And of course, this is the commercial that advertises it, and the commercial signifies a product. It signifies Pepsi. But now what we're seeing is YouTube videos. This is the case of someone discussing gut health, food and drinks, or we see a post on Instagram that is a plate full of food. And there's a real confusion between, is this a commercial or is this a product, or is this selling something or is this not selling something? It's very much a gray area that distorts the division of these two lines. And of course, we know that the way that social media works is that popularity wins. When something starts to become popular, it becomes more easy for that to become more popular. So it has a cascade effect. If something can generate some clicks, this has been shown for some empirical studies, that if something can generate clicks and attention, it works in the algorithm of these platforms to then generate more clicks and more attention. So it's very difficult sometimes to stop those trajectories when they start. So we were our research team. This is our research director here in the top right with the black glasses. The project was led by a doctor professor from the University of British Columbia here in Canada, looking at the microbiome, and specifically the microbiome as it pertains to asthma in children. And there's a lot of really interesting microbiome research going on, but it's very much in the nascent stages, in the early development stages. But this hasn't stopped the idea to be created in popular culture around this idea of a healthy gut or gut health. So kind of taking very nascent, very developing science and immediately having things to say about it or to portray it in this form of a healthy gut or gut health. And so what happens is this kind of becomes a marketing tool for products, and even more so, alongside that, I should say, it acts almost as a rhetorical product in itself. And so it becomes this thing that people can use to create attention on social media. This works for media platforms. For example, if you have a website, you can start to create discourse around what a healthy gut is or how it affects you. You can offer treatments or foods, which generates attention for your website. And we see this kind of happening all over. This is a celebrity chef, a celebrity health advisor, I guess I should say, called Dr. Oz. He's on popular health shows, and so he has discourse talking about how to nurture your gut bacteria to improve your mood. This is a famous online influencer in the United States called Ben Greenfield. He has quite a few followers. He has products related to gut health. This is the personalized plan to transform your health from the inside out. And of course, once you are engaged with someone like Ben Greenfield and you follow him and you take his information, you're also subjected to some information that he's been sharing about vaccines. So he's sharing very problematic, ideas around vaccine, which can create vaccine hesitancy. And you can see here again, this kind of catchy idea, the shocking truth, right? It touches on people's sensations. Another case, the Food Babe, she has over 1 million followers on Facebook, and she has products related to gut health on her website. The Glorious Gut Probiotic Supplement, she's talking about the importance of gut bacteria in pregnancy. So again, some kind of definitive statements about things that are not so definitive. So these are people that are already kind of health celebrities who have incorporated gut health into their online presence. But some people actually have started accounts specifically on gut health. So we have accounts, this is from Instagram and Twitter, like Gut Health Recipes, or specifically the Gut Health Nutritionist. We have books coming out on how to reboot your health in just 20 days. Facebook is full of webinars and masterclasses and gut health kitchens, the Gut Health Project. We get people who are acting as nutritionists. We're not entirely sure what their credentials are, and they offer consultations, in-clinic consultations or online clinic consultations linked to products, etc. So a very crowded, very problematic space, using this idea of gut health to basically promote either their sites or to promote products. When we were studying the idea of immune boosting as COVID-19, we had a federal grant to look at this kind of inaccurate idea of boosting one's immunity during the pandemic. Coincidentally, what we noticed is that over about 30% of the web pages also mention this idea of the microbiome or gut health, and that was generally intertwined with the narrative of immune boosting and emphasized its importance for overall health. And it reads here, for example, one page states, yogurt is considered a probiotic. It's essential for your immune system health, directly affects your gut, helping the good bacteria thrive. Your gut health is directly associated with your immune system. Therefore, a healthy gut means a healthy immune system. So these kinds of messages or discourses overlap in different topics. They could be selling a supplement, offering you immune boosting at the time of the pandemic, which could affect perhaps other behaviors that you might take to mitigate the risk of catching the pandemic or spreading the pandemic. So of course, there's obvious concerns. We have the commercialization of products and programs which lack evidence. We have just a general weakening of scientific understanding. If we have people promoting ideas that are not scientifically sound, how does that help people understand the way that nutrition or science can work in all kinds of realms of health? And of course, it creates this considerable media noise, is a phrase that I think is really helpful, that it kind of drowns out other information that people need to hear. This is an excellent, very short piece that talks about this, called Neglecting Major Health Problems and Broadcasting Minor and Certain Issues in Life Sciences, which basically just talks about this, that there's so much information created, which even if it is somewhat accurate, it's just not very helpful aside from those core messages that people need to hear. And lastly, we see the weakening of the role of experts and expertise. So how is it that people who are experts or who know a lot about a specific topic try to get that evidence-based information in here when all of this other discourse exists? So what we need to do, of course, we need to monitor online information critically. And this, which is a theme that's come up in the previous 3 talks as well. We really need to be aware of the specific bunk on specific topics in particular contexts. So it's not enough to just say, oh, there's a lot of poor information out there. We need to know specifically in what context, what kinds of poor information exists. And that way we can start catering responses to counteract that, which of course is going to need engagement from experts. It's going to need people being active in some of these sites, helping people be aware of the misinformation and specific misinformation that's out there, guiding people towards better information. This would be offline as well as online. Not everything has to be online. It includes the continual education, so kind of education of basic science or why some things are implausible to happen because of what we understand about health sciences. We need to help counter misinformation. So this active approach is to debunk that misinformation or to counter that misinformation that we see that's out there. And of course, this has come up as well in all of the previous talks. We need to make fun, creative, and accurate content to share with others. You can't compete with people who are marketing experts with content that doesn't also align with people's desires and wishes and emotions. Basically, it needs to, the content that we create that's evidence-based needs to work in those same parameters. Of course, we all need to push for tighter regulations. This is specifically tighter regulations on our media companies. A lot of pressure has been put on some of these big media companies here in North America to not allow kinds of fake information to exist or to curb fake information. And this happens because a lot of experts try to push for some of these tighter regulations. There's really some really interesting examples. Of course, all these, the ones that have been shared in previous talks, but here's an idea of a page called Skype a Scientist, which connects scientists with elementary school classrooms, all done through Skype. So an expert in biology or squids or nutrition can take 1 hour of their day and Skype with a classroom of kids and help them understand basic science. So it's very kind of fun, easy intervention that we can use. In terms of debunking information, we have some information on our website at the University of Alberta. We're in the Faculty of Law, our Health Law Institute, and our director here is Professor Timothy Caulfield. He talks a lot about debunking information. This is a slide from his presentation. You can feel free in the recording or now to take a screenshot. These are just some tips, evidence-based tips that Professor Caulfield has compiled to counter information. And in the top right there, we have a Fighting Misinformation PDF that we've compiled at our institute that just goes through, some evidence-based approaches that people can use if you do want to combat misinformation directly on social media or different platforms. All right, thank you very much.
Thank you so much, Alessandro, for a very interesting presentation and for sharing also resources that people can use in their work forward. I think you bring up some very important issues, and thank you for mentioning the commercial determinants of health as well, the issue with marketing and the different interests that compete for our attention in online, in digital communities and digital spaces. So I think that's very important for us to take forward as well. Our next speaker, I think while you were presenting, I was thinking about how it is crucial for us in health and in nutrition to engage more and more with multidisciplinary teams that have the expertise on understanding the media, on understanding also how the technical part of computer technologies to help us build tools from the start, but to understand the whole process so that we actually can compete in this attention economy that was mentioned, because it is really very tough competition. And along those lines, we have our next speaker, which will present us with some practical and concrete things that can be done as well in a processing programming, for example, for management of nutrition data. And that is Shrurit Lingala. He is the manager of technology and entrepreneurship at Cytolife. He is a co-editor of Cytolife's magazine Data in Nutrition and works with designing and implementing social and technological innovations to make nutritious foods affordable, available, and accessible in low and middle income countries. And if I'm not mistaken, you do have a background in computer technologies, do you not, Srijiti?
Yes, I do. Yes, Sabrina. Thank you very much. Can you see the screen?
Yes.
Great, thank you. Hello and a very, very good day to all of you. My name is Srijit Lingala, and I am the Technology and Entrepreneurship Manager at Cytolife. First off, a huge shout out to you and Unscn for this amazing webinar series that shines a much needed spotlight on the tectonic changes that have been happening in the nutrition landscape that's driven very much by data and digital innovations, and to all the amazing speakers who went before me for such innovative and informative content. Thank you. Cytolife is a nutrition think tank that designs, supports, and implements evidence-based solutions to malnutrition. Originally, what started as a humanitarian aid organization, we've continuously evolved in response to and in anticipation of the needs of the ever-changing nutrition community and the landscape. We now reach out to the food and nutrition insecure populations by focusing on 3 specific areas. First, we translate nutrition science so that programs, policies, and participants are informed and effective. Second, we bridge the nutrition expertise and the priorities of the public sector with the know-how and the reach of the private sector by building robust public-private partnerships. And third, we design and implement sustainable and social business models that are profitable and are able to improve the availability, the accessibility, and also the affordability of nutritious foods. Moving on to the data part of it, from social media and satellite navigation systems to mobile phone apps that count calories, robots that fight climate change, and governments that forecast future disease outbreaks using Google. Data has literally transformed our society in unprecedented ways. And still, somewhere, nutrition data still remains fragmented and incomplete, particularly in low and middle income countries, which makes it very difficult for governments and also development partners and other stakeholders to access and use. As we as a nutrition community strive to end all forms of nutrition by 2030, there is definitely an urgent need to harness data to track progress, to hold stakeholders accountable, and foster rapid collaboration. And for that, being able to collect, analyze, and translate that nutritional data is essential to understanding the challenges and making important decisions for us to be able to meet our goals. And that's where the data value chain framework comes in that you see on the screen here. It has been extremely helpful as we think about integrating data in a way that is not just a crutch to support some of our interventions or some components of our interventions, but we see it more as a core element that helps us achieve our nutrition goals. And this end-to-end approach encompasses multiple links, all of which need to be adhered to, all the way from prioritization of what to measure and how to measure, through to the collection of that data, effective curation, working synergies between data sets, and analysis of the data and its translation to evidence that is able to, in fact, galvanize decision makers and policymakers. Here, we use the data value chain as the organizing framework to discuss the gap areas and the ways in which technologies are changing and how we address malnutrition. I'm also going to highlight a few examples of innovations and throw some light on some of the innovations and resources that we all can use in our day-to-day work. The first link in the chain is prioritization, which is defining priorities and standard indicators that all nutrition actors agree on and work with. We did a very interesting research at Cytolife. We were interested to understand how our own team members at Cytolife feel about accessing data for their day-to-day work. And an overwhelming 70% of all of us felt that data required to do our day-to-day work is neither readily available nor is accessible. It's difficult to access data and to understand what data to access. And this resonates, in fact, with the sentiments of the larger nutrition community. In fact, the Scaling Up Nutrition Global Network has called for clear guidelines and guidance on what nutrition data to prioritize that you see on the screen below. This is basically on hierarchy of indicator categories, understanding what those definitions are, what are the appropriate data platforms, how frequently should we collect the data, and also examples of data reporting. So this is a clear gap area and a clear chain that needs more work on. The second link in the data value chain is creation and collection of the data, which is the ability to generate high quality, reliable data. But all too often, important nutrition and health related data that can inform our program implementation, which if I have to take examples from my recent work, I wanted to know what is the pharmacy density in Burkina Faso and Bangladesh. I wanted to know what percentage of pregnant women receive antenatal care, and even critical information such as stunting and wasting. All of this data is, not all of this data is available for all the countries at the same frequency, which makes comparing different data a little bit more difficult. In that space, mobile data collection, which some of the speakers before have alluded to, can be a valuable tool for collecting nutrition data remotely from populations that are difficult to reach. And a few examples include open source platforms such as ODK Collect and Rapid Pro, where it's very easy and efficient to create our own modules and forms which governments and development actors can use to collect information, and also engage with the most important and most marginalized voices in their communities to hear their voices and to know what they're saying and to reach them also. And tools including SMS surveys, automated voice calls, and web applications are in fact able to collect household and community level information. They're able to track nutrition and dietary habits and conduct baseline and inline studies. And Inka's presentation speaks very well to this about while these are great platforms, there is also the gaps that that she's highlighted in collecting using mobile applications. So I wouldn't want to delve more deeply into that. And next is the next link is data curation. And before delving into the next link, I'd like to share a very interesting insight that I came across. Sabrina was saying I was a computer science I've done my engineering in computer science technology, and somebody who started their career in coding, I can't help but think how all coders' first program that is one that asks the computer to print just 2 words. It's called Hello World. A pretty straightforward code, literally takes 4 lines. But mind you, it's the very same coders who've gone on to build technologies that boggle our minds. Computers that can think on their own, recognize my voice, recognize my face. And all of this is possible, as such giant leaps in productivity is possible because of data interoperability, the ability to use someone else's code and build on it and build and go leaps and bounds beyond it. And the curation stage of the data chain is all about aggregating the data collected and building synergies between different data sets, making them speak with each other. However, because of multi-sectoral nature of nutrition, data which comes from various sectors have limited ability, have thus far had limited ability to connect in a coordinated manner, in fact. But a brilliant exception is an app called Dalili that I wanted to talk to you about. It's a very innovative tool that uses smartphone-based data curation to put affordable, nutritious foods in the plates of the most vulnerable people. It's a smartphone app that's been developed by the World Food Programme that communicates with data from local shops in Lebanon, and it compares prices of 250 staple foods. It works with all of these data sets. It pulls out the insights and shows it to the users. And users can compile shopping lists and leave anonymous feedback to help shop owners improve their stores. The app has had more than 20,000 users, and is actually an important step in empowering families to take control of their own nutrition and health. And there are also other initiatives such as the Global Open Data for Agriculture and Nutrition, the Global Partnerships for Sustainable Development in Data, and Health Data Collaborative. These are all examples of global partnerships that have promoted data interoperability and open access. And the fourth link is analysis, where we synthesize data, we build analytical tools and models to derive those insights. And a great example here and a great resource that we might want to tap into is the JP Morgan Chase's Force for Good initiative, where nonprofits and the development sector actors are connected with the resources of multinational IT companies to build state-of-the-art customized digital tools to be able to analyze data in real time. In fact, Cytolife has partnered with Force for Good to develop a digital platform that collects data from remotely located poultry farmers and analyzes it real time through an interactive dashboard, thus offering the entrepreneur who's working with the farmers, but also the farmers themselves, quick and efficient decision making and improving productivity. This, in fact, improves farmer productivity and also improves availability of nutritious foods. And better decision making and accountability needs data to be accessible and usable by all stakeholders. All too often, I've heard and have experienced being bombarded by information and analysis that is too much to take into. It's too difficult for my brain to understand. And there's all too often, there's a information overload and fatigue. This is where translating all of the analysis and all of the links earlier into an actionable insight is at the heart of the data value chain approach. My heart leaps literally when I see a nice infographic in front of me, somewhere that I can actually take information from and act on it, rather than just data and data and data where I have to make sense of it. And that is what the next translation and dissemination is all about. In fact, recognizing this very critical need, Cytolife has developed a series of very easy to understand and share infographics for use in the policy-oriented communications. They can in fact be accessed from our website, www.cytolife.org. And for all of us, me included, who know the importance of understanding and visualizing data, I'd really encourage you to look at the article Portraying Your Data by Annie Millen. It's available again on the Cytolife website. I'm actually, in fact, placing them in the chat window for your reference right after the talk. And over the last 10 minutes, I've aimed to illustrate the various chains of the links of the data value chain and the gaps and some examples of how innovations across the chain can impact real change. It's only normal the challenges exist at each link in the nutrition data value chain, all the way from prioritization to analysis, which currently fails to capture the complex multi-sectoral causes and responses to malnutrition. However, all of the new technologies are actually pushing the envelope, and they offer potential to strengthen nutrition programs and improve outcomes. That's it from my side. Thank you very, very much for your attention. Over to you, Sabrina.
Thank you so much for your presentation, and I couldn't agree more. I'm also a very big enthusiast for data visualization, and I get really excited when I see people being able to translate it in a way that is palatable, interesting, and appropriate to the level of the group they're communicating to, either if it's frontline workers, or if it's politicians, or if it's the general public, or if it's children, or any other specific public. So thank you so much for your very interesting presentation. And I would like to invite all the speakers to turn their cameras on so that we can have a round of questions. I have seen that, I don't know if participants have been following along the Q&A box, but most of the questions have already been responded. So the speakers have been very effective in providing the answers in writing, which is great, because then it's you also have links and references for the specific questions that they have had. So I would like to ask, we have 15 minutes left. So I would like to build on some of the aspects that have come up in the questions, but not many of the specific ones that have already been answered. But I would like to ask a question for all of the speakers, thinking about the following scenario. We have addressed today issues, projects across different platforms, either online or offline, but all digital. We have had examples of high-income countries, middle-income countries, and low-income countries. And some of the participants have alluded to the need to make sure that the information reaches people that we are talking to, taking into account structural factors, infrastructure, and things such as digital literacy. And throughout your presentations, I was thinking about the digital divide, which is exactly the fact that regardless of where you are in a high-income country, low-income country, different groups have different access to the technologies that we are talking about here. And those are related to the social determinants of health and to structural problems that we all face as barriers, regardless of the context we are working at. So my question to each of you is, how can you, in the context you are working on, in the context of your projects, in the context of your work, what kind of difficulties have you perceived in terms of the digital divide? And what do you think we need to be able to overcome those difficulties in terms of digital literacy and tailoring messages and really reaching the public that we are trying to work with? So I think maybe some of you want to think for a minute, so I can accept a volunteer to start sharing some insights. Or we can go on the order of the presentation. Yeah, Sujit.
Hi, thanks, Sabrina. That's a very interesting question and something that I've been grappling with as well. I can speak, like we have been trying to work with smallholder farmers who are remotely located in Malawi and trying to gather information about their farming practices from them and also give training to them. In terms of collecting that information, I think we do have various kinds of data collection tools and devices, some that only work on Android, some that only work some that also work on the mobile phone. So I think it's very important for us to be able to be mindful of that digital divide when we are actually developing the application. Knowing that we are working with remote farmers in Malawi, just understanding what those farmers actually want, what is their bandwidth, doing something as a small field, Ricky, understanding what they want, how do they use their phones, what do they use them for, will give us a lot of insights into developing that platform. So my insight is start at the very beginning to think about these very important questions rather than towards the end.
Thank you very much. So
perhaps
yeah, Inka, please.
So perhaps I mentioned this already a little bit in my presentation. In nutrition, at least in the two countries that we evaluated, Tanzania and Ghana, reach and uptake were huge barriers, and probably one of the main reasons why there was not a lot of impact of the intervention. And to be honest, I'm not sure how to address this and how soon they will be addressed. As part of the evaluation, we also did a business model analysis and kind of explored a little bit how attractive it is actually for mobile phone operators to increase network coverage, for example, or make mobile phones more accessible for the kind of the bottom of the pyramid. And there were not a lot of incentives actually to invest in this particular group, because this particular group won't create a lot of revenues anyway. So actually the mobile phone providers focused a lot on increasing 4G or 5G network coverage rather than going into every village and trying to increase network coverage there. So I think it will be really difficult to kind of really capture everybody. And I think sometimes it might be a good idea to perhaps look at different technologies, not just mobile phones, but for example, also go back to radio, because radio coverage was actually in the villages often much better than mobile phone coverage. And then one other thing I wanted to throw in is what type of engagement we actually need. For example, in kind of behavior change, digital behavior change intervention, there is some discussion about effective engagement and whether effective engagement actually need to be sustained engagement. So what we found in the qualitative work in particular is that in some cases, actually one single message triggered a whole massive behavior change. In, for example, one woman, she heard, she received a message on animal farming. It was more the agriculture messages, and she really followed onto this. This was like the last drop that made her change her behavior. So perhaps there are different ways of looking at engagement in the digital sector than there would be in other behavior change intervention. So perhaps different ways of thinking about it. Thank you.
Excellent. Thank you so much. And I think it is very important for us to recognize those very real problems that we have in implementing, even if we still don't have a solution for them, but so that other people that also work in the field, that they recognize that some of those problems, they are happening in different places as well. I think it's always good to have that sense of community and try to find solutions together. So, and that's exactly when you spoke about reach and uptake, that's exactly when it got me thinking about the digital divide playing a role here. So that's exactly the link that started it all. But Archana would like to.
Yeah, as you know, this e-learning platform was basically for the rural health workers who had, very low literacy level, as well as stayed in remote areas, and also had very low access to all the facilities and benefits. And so it was mainly done for them, so that the visual and everything was made accordingly. But one thing that we understood is that, to have phones, because they were mainly using mobile phones, and to have the kind of mobile phones that those who have a smartphone, they were not the very high quality kind of a smartphone. So, to provide access to good phones in the remote areas is also a digital divide that we kind of faced as one of the implementation challenges of this platform. Because the better the phone is, the more it is accessible and the more interesting it is to the health worker, or the nutrition worker who was using it. So that's a kind of a digital divide, you can say, that we experienced in our project, although we made it especially for those like in remote and those who do not have that much access to all the facilities. Yeah.
I can just touch on a couple of those points that were raised. So in Canada, the basic situation in Canada is that up north, the farther north you go, the weaker your internet connection is. And we've recently had our Prime Minister state that he would like to provide access of a high level to all areas of Canada. And that hasn't come just based on his own desires or own volition. People have been really pushing for that for a long time. So it's not going to be a change that can happen overnight or even over the course of a couple of weeks. It takes, I've been to conferences before where people continually make the connection between internet connection and human rights, education rights. If you want a right to education, you need to have the capacity to access that education. And on that same note, I have worked up north in Canada before, and I do want to identify that when we talk about digital technologies, it doesn't always mean online technologies. Digital technologies are digital. So in the case of the North, what's very popular is DVDs. DVDs are used a lot. So people, they can be entertainment, but also educational DVDs. So if we were, in the case of to put together webinars or things like that, we always talk about having internet access, making them online, but you can potentially make them into DVDs and send them to areas like you mentioned, Inka, with radio. I think it could be similar to the ideas of DVD players and TVs, which can exist in more remote areas that can still get access to that digital, easy to ship, relatively inexpensive to make and distribute. That's not a solution to the online gap, but it's a way of patching or augmenting some of those gaps with still with digital technologies that are, you know, easy to disperse.
Yes, that's right. And making use of the solutions that we have available at the moment as we build a way to better solutions and better infrastructure. So great points. Fernanda?
Thinking on Brazilian reality, I think it's important to keep in mind that before we discuss the digital literacy, we need to discuss that not most, but many of our population do not know how to read, nor to write. And when we want to use this social media, we need to keep this in mind. So in our project, most of our participants prefer to use WhatsApp because they could receive videos and send and receive audios. And in another project in the medical school that I work, we usually use these tools as well with elderly people and with those who does not know how to read or write. I believe we need to make it up to these people as well, because they deserve it as much as other to receive good content, and as well as the other researchers said, to receive good quality content, and we need to adapt our conduct to them.
Yeah, just if I can add to that, maybe I've already mentioned in the presentation that, you know, it was mainly offline. So like, you know, offline was also there, that it could be downloaded in offline version, you know, as Alessandro also said, in DVD. So that also kind of reduced the digital divide also. And also we did a kind of a competition of this, like who could complete this. So that also kind of motivated them to reduce the digital divide also, so that people, you know, the Anganwadi workers tried to get access, the supervisors also helped them to get access to this. So yeah, this could, you can say to some extent it reduced, and it also improved the access to the remote areas to this technology.
Can I ask one question in this regard? Do people know about phone recycling programs? I've just started to think about this actually in the week in preparation for this, that there's just so many phones that people use on their contracts, at least here, and they kind of go to the end. It's a totally workable phone, but I think a lot of them just end up as waste. I'm wondering if there's any programs that kind of connect phones, old phones, to anywhere.
Not that I'm aware of. Does any of the participants have? No, but I think it's an important point, something for us to be aware of moving forward, because thinking of environmental concerns and the amount of waste that it can generate. So absolutely, I think it's a very important point. We have 2 minutes left, so I would like to ask Judith to respond in the chat. You have received a question that we will not have the time to address here, but if you could have a look at the chat and provide Sonia with a reply. And also, Fernanda, we have been asked if any of your social media posts are available online. So if they are, if you could post a link on the chat, that would also be great. So I would like to finalize by saying thank you so very much to all the speakers that have presented such very interesting and diverse presentations today. I have learned a lot. Thank you so much to the participants who have been with us until here. And I would like to finish by sending a reminder to take part for you participants and speakers to take part on the Unscn Knowledge Management Survey. We will post the link again on the chat. Please don't forget to do that. We have shared a link for the Unscn Nutrition 45, where all the papers are. And next week, no, not next week, on a couple of weeks, on the 3rd of December, we will have the 3rd episode of the Unscn webinar series on nutrition in the digital world. We also have a very exciting lineup of speakers then, and the theme will be data-driven decision-making, focused on vulnerable groups and inequalities as well. So we will, in a way, continue the conversation that we started here during the discussion. So you're all invited to register for that. We will put up the link for registration very soon on the website and on social media. So thank you very much for now, and have a nice day or evening forward. Thank you, participants. Bye, everyone.